Hey everyone, welcome to Let's Talk About the POTS Life, your go-to podcast for all things POTS. Whether you're living with POTS or supporting someone who is, this is the place for you. Welcome back to another episode of Let's Talk About the POTS Life. Today, it's a little bit different. It's just myself, and Brittany will be joining us for a future episode. But I'm very excited because we have a guest with us, and it's Dr. Cohen Solomon. And we are excited to have you. I know we connected on Instagram, and, I feel like we're kind of in this world where everybody's content shows up on different places, but I love this perspective because it's an EDS perspective, and I feel like that's something we kind of touched on, but I'm excited to dive in more today. So thank you for joining us.
Thank you so much for having me. I think one of the best things we can do in these spaces is make connections genuinely.
Yes.
I think it's an error in medicine and in life to assume that everything is totally siloed and that one person's concerns or medical, solutions even only affect one person or the other. So I feel like there are so many available puns in the connective tissue realm to connect all those dots. It's hard for me to stop. My patients always know I'm ready with a bad pun. But
I love that because it's true, though. I mean, everything's so interconnected and, especially in this world that we work in, everything, it's so multi-system. And if you're just looking at one thing, you're missing how many other things.
Yeah, absolutely. So, all right. So I'll start with my background and how I ended up in this sphere. So I am a board certified general pediatrician. And without getting too into the weeds, when I was fresh out of residency, I was living in a different country with my husband, and I had a handful of these conditions that I treat. But because we were out of the country and I needed to go up and back to work, long story, I ended up at a private practice that was exclusively for these conditions. And it was sort of the universe saying, haha, here you go. This is your sphere. This is what you are meant to do because of your lived experience. And I don't regret that at all. But the journey was a funny one in that regard. So from a medical side, my diagnosis of hypermobile Ehlers-Danlos syndrome was about almost 20 years ago now, when I was 20. Yeah. It's weird to say because I mostly see teenagers.
Right.
And so I would never want to admit how young I'm not because I feel like I lose street cred.
But I also feel like I'll be 37 in November and I don't feel that old. So it kind of, I'm like, you hear these younger ages. I'm like,
anyway.
Yes.
Yeah. But also I feel like I'm a good example of how these conditions, manifest as a younger person to middle, whatever I am. Right. So anyway, I was diagnosed with the hEDS at age 20. And I can't actually remember when I was diagnosed with dysautonomia. But I do very strongly remember the tilt table test day as like the worst
I was going to say burned in your memory.
Oh, awful. Just terrible.
Yes.
And I was a point shy. I was a point shy, and it was recorded incorrectly because I was, pre-med. I was watching the little thing go up, right?
Right.
But I can tell you that at home, I fit criteria just fine. So that was a really unfortunate sticking spot of diagnostic error. I did receive the diagnosis of orthostatic hypotension. So much later, people started treating that appropriately, but not at that initial stage. So, that is just a small snapshot of the things that brought me into this realm as a clinician. I always wanted to be a doctor, but being able to bring in what I've experienced, both good and bad, and have that, inform my clinical practice is tremendously meaningful to me. So,
and to others and to your patients, I think. There is no, and I'm sure you hear this all the time, to hear from others that say, it's so nice to talk to somebody who gets it because it is so frustrating, these diagnoses that run together. There's no cast on your leg. There's no something that, people could say, oh, honey, do you need to sit down? It's visual. And a lot of these are so silent and it's just, for somebody to understand, I think that that piece as a physician is just has so much value.
Yeah, yeah, I agree. I wish that wasn't the case.
I know.
Um,
Right.
right. We should all just have empathy. But
Hmm.
when you bring in an experience, and it doesn't have to be identical,
Right.
right? There are all sorts of chronic illnesses that lend themselves to the life experience of someone who doesn't appear sick,
Hmm.
or a dynamic disability that might change day to day. And you can connect on that level, but you're also allowed to connect on a human level, whether or not you
Right.
have those things. And the idea that so many patients come to me having had tremendously negative experiences with other clinicians before they see me is really heartbreaking. And I just wish something more had changed in the last 20 years. But then again, I do see a lot of change in the last handful.
Correct.
A lot of
It
change in the last handful.
I think if anything, at least people are talking about it or learning about it.
Mhm.
Or like I said, I'll be 37 in November, and now I have two boys. I have an 8 and a 5-year-old. And even looking at my 8-year-old, yes, I come from the physical therapy background, so you're watching things a little more, watching gait patterns, or just it's like, part of our nature.
You
But
can't stop.
yeah, you can't stop. But now looking, it's like looking in a mirror, right? I
Mhm.
have noticed, oh, I think he is. And now knowing I'm hypermobile and seeing those things and patterns growing up, you can connect dots. But looking through as a mom lens now, I'm able to pick up on things so much faster. And I do believe, like, we saw rheumatology. And I think now you're hearing about pediatricians or pediatric providers picking up on things. And now I'm like, oh, he is hypermobile to the max. I always say, like, the party trick person, if you can do something bendy or weird, or it's more red flag. So I hope you're right. People are just, finding it more. But I also know on that other side, from a pediatric standpoint, I mean, what you do is so important, because I think it is, being a parent myself, you're going to move whatever mountain you have to get them the care. And it's hard to get care as an adult, but I believe for a pediatric setting, it's even harder.
Yeah. I mean, it's a good point. It's who has it worse, right? What a terrible
Right.
game to play.
I know.
But I remember actually when I was choosing, not even pediatrics chose me. Let's be totally honest about this. But I remember foolishly pediatrics gets a lot of like, oh, you just want to do peds when you're choosing your specialty, which is ridiculous.
Hmm.
We can talk about that another time.
Yeah.
But for me, I remember feeling like, well, you're always going to be interacting with family members no matter what field, almost no matter what field you go into,
Right. Right.
essentially. But for me, if a family member, or especially a parent, is freaking the heck out over the wellness of their child,
Hmm.
I can pretty much tolerate anything from that parent.
I was going to say, yes, you can. You're
Like that's
good to go.
really easy
Yes.
in my head to be like, well, yes, you are frantic. You
Yes.
are scared to death over what might be happening undiagnosed for
Hmm.
your child. Okay, do I want the temperature in the room to be controlled? Of course I do.
Right.
But also, can I forgive you for a lot? Yeah.
Hmm.
So yeah,
Hmm. Right.
so it's just a different beast. It's a different beast, but
It is. And everybody's, meaning well, and you're just trying to get to it comes from like a point of control. It's hard. I think for, I say myself, obviously I went through all of this, right? All the different providers and specialties and looking at things separately. But then for my son, it's like, I could handle it because it's for myself. But when it's for your child, you're like, like you said,
all bets are
the
off.
temperature. Yeah, the
Yeah.
temperature in the room is hot. I
Yeah.
get it.
Well, and it's funny too as well, actually, because very often people assume, not totally incorrectly, that I'm doing all of this as from my own like catharsis or my own personal whatever. And those are true to an extent. I also, by the way, genuinely find my field interesting. I wouldn't do this otherwise.
Right,
So
right.
this is not a vendetta, people.
Right.
But a lot of my motivation came from watching my parents, but in particular my mother, fight the fields to get my
Yep.
sister and
Oh,
me
I
the care
believe
that
that.
was necessary, right?
Hmm.
And this was early days yet, so I still have very potent images in my head of she had her, and because this was before EMR was like a popular thing, by the way. So there was a little. I still remember the first doctor who typed in the appointment. My mother was livid because they like barely made eye contact.
Yes, just typing down.
And it was the beginning of the worst year of my medical life specifically, and my mother was terrified, and my father had just died, so I was getting stamped with that label inappropriately.
Oh, easily,
and we drove home, and it was just like. I mean, neither of us will ever forget it. Anyways, the point was, I think, honestly, the suffering of the parent and mine in particular is what drives me maybe more than what I've been through and what I see kids going through as well.
And it's just, oh, man. That's just people listening. And I think that's what happens. We get a lot of parents, too, tuning in, like, how do I help my child? And I think just hearing that, it's like, they'll be like, where can I come to her? Where can I see her? Because caring, not that there aren't other great caring providers, but personal experience and the care and the empathy. And I just think it's, like I said in the beginning, just so valuable. Now, let's talk POTS and EDS and things that you see. So obviously let's start with the EDS because I know what people look for, but I think I'll see a lot of parents will be like, well, and I always see, well, she's a dancer, a figure skater, there's certain swimmers, there's certain activities that I think kids draw to because but like how about some signs that you look for or what symptoms might be like, hey, you should go look at EDS for your child?
Yeah. So first of all, I want to emphasize that there are, depending on who you ask, either 13 or 14 types of EDS. So about 80 to 90% of the people with a type of EDS have the hypermobile type or indeed the HSD, which we can talk about that spectrum later. But there are other types that are much, much, much more rare, but do not all look the same at all. So it's really important to understand the distinctions, that we're not always talking about the same condition if I just say EDS. And since there are some conditions that are so rare that they're even worse, recognized within the EDS sphere, I don't want to leave them out of the conversation, and I don't want to accidentally lump them into the hypermobile type.
Right, definitely a scale. Yeah.
So if we're talking about the hypermobile type specifically, and I'll lump a little bit of the classical and the vascular can look extremely similar to the hEDS. So truly, the following symptoms, if your child is experiencing them, they should be checked out regardless of what type we think is involved. And what I hear most and earliest is pain and fatigue. And the pain might not manifest the same way as it would in an adult, where an adult might come to me and say, or even an older teenager might say, okay, I have pain all over every day, or I have pain in these particular joints every day, widespread, things like that. A kid is gonna just look more like they're not keeping up with their peers. So they might be more tired on gym class day. They might be the only one who can't make it to the sleepover or have to come home early, or they might be the kid who, if they have a birthday party Saturday afternoon, do not schedule anything on Sunday. They won't have the energy.
It is so true because I think having two boys, it wasn't until I had my younger one that I said to my husband, he's just so tired. Like it was just, it wasn't adding up. That I'm like, especially boys like have go, go, go. And it was exactly what you said. If we had one thing, kind of look out, we couldn't have double.
Right, exactly. So having to sort of automatically include pacing in your day-to-day scheduling, right? You can't do two things the same day. It's just not going to happen. But being able to compare as well, if you look around the rest of the dance class and your child is the only I'm sorry, I'll explain why I'm laughing. If your child is the only one who needs to step out for a break or a snack, and the reason I'm laughing is because I didn't continue ballet classes because of how often I needed to step out for what my mom would call a protein break, which was basically peanut butter on a spoon, and she just shove it in.
Listen, I use that like daily for my son, so I
got butter on to dip apples in literally every morning for my mid-morning snack.
We call it a peanut butter lollipop. Is what we call
perfect. That's fantastic. So look, protein very important for stamina. Love it. But also no one else needed to do that.
No, not during your 45-minute dance class.
Now, interestingly, my twin sister, who has the same set of criteria or diagnoses, she didn't have to do that, but she has more of a sort of inner motor drive to deal with her pain and fatigue. She just kind of goes. And I to use a technical term, poop out earlier.
Yeah, right.
Yeah. And it's, not every child is built the same way. And it's really important to recognize that. Anyway, so if you are noticing that your kid is just not keeping up with the others, like that's an instinct that families tend to have. It's not necessarily like I can put a scale to it and say, 4 out of 10 times they are not making it to the play.
Right.
No, it's a feeling. This is a feeling.
Yep.
By the way, that's a very non-specific feeling. So it's not that only applies to this, but I would say if your child doesn't seem to keep up with other kids, go to the doctor. Just talk it out with the doctor. And it might be that the first couple of times you bring it up, everyone agrees that there's nothing serious that moment. But tracking it, making sure that it improves or seeing if there are any changes, that's where it becomes important. Because right now there's no early detection for this. That's a long-term goal of mine.
Right. I love that. Right. But you're right. You don't.
Yeah.
It wasn't on my radar.
Yeah. Why would it have been?
Right.
And these days, fortunately, medical schools are starting to recognize that it needs to be taught more appropriately. I'll tell you, when I was not just in school, but when I was studying for boards much more recently, all the EDS types are lumped into one slide. You're lucky if it gets a full slide. It's usually like a line. That's just not adequate. But also what's said is not accurate either. So I would usually sit in my med school lectures with like a little row of friends, and they all knew I had the things because it was easier that way.
Right.
But the slide went up during a rheumatology lecture, and all it said was blah, 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 EDS, again, all lumped together, risk of berry aneurysms. And the whole row just turned to me as one with horror in their eyes.
Like, did you know this?
Like, everyone just take a breath. Like,
yeah.
And it was such a moment of like, oh my God, this is such, so I was so annoyed with the curriculum for their inaccuracy that I went to the director of that set of like semester lectures. And I was like, look,
we got to do
have
better.
This type. Can I do something to help? And I did. And my twin sister was in law school, like across the same city at the same time. So we went as like patient examples, if you will.
Yes.
And we gave one of those like day in the life talks.
Yes.
It was so funny because we had the option of like, do you want all the students to wear their white coats? I was like, I don't care. It's just me.
It's just me. I'm in this. Yeah.
Right. I'm in the boat with you guys. It's all good. But it was a really great discourse, and we didn't get any of the weird questions I was expecting to get, honestly. But we were able to give, if I do say so myself, such a good talk that several years later, a cousin of someone in the class connected her cousin to me now, and she's now a mentee as she goes through med school.
Oh, I love that.
And 2, someone who was in the class, because I moved my school year around a little bit, so I was ahead of her, and then she jumped ahead of me. So anyways, we graduated a few years apart, and then she now sees a lot of overlapping patients, and she sends them to me because she remembered me years later.
Yes.
You know?
You have no idea the impact
Yeah.
when you're starting something, and especially like the impact that you made. Who would have,
Yeah,
that's
I
the
just
hope.
wanted them to not do a bad job if they ever saw one of these patients.
Right.
Like,
Not to dismiss or just say, oh, that's it, the aneurysm. Like,
I just wanted one little thing in the back of their minds that you had to just take things a little more seriously and not just off the cuff. And
little seed. Plant one little seed.
Exactly.
Yes.
Exactly. So I think, the internet, oddly enough, has given us a lot of value in that regard where people who would not necessarily have had access to human stories elsewhere have access.
Yep.
We no longer have any excuse to not know about a subject because we have the internet at our fingertips.
Yes.
But people are putting their own life experiences up, and that matters. That matters a lot. So if physicians and all sorts of clinicians can see that and connect with it, I think it makes a huge difference. Now, unfortunately, a lot of us in our ivory tower kind of look at the social media and say, oh, well, that doesn't count as data. That can't be real because it's, just individuals putting up their own experiences. I'm going to look away. Don't do that. Please don't do that.
No.
By all means, take it with a grain of salt, POTS pun intended, and make sure that you're sorry. Not sorry.
Love it.
It's valuable from a research standpoint that we can't take everything literally at face value. Don't do that. Not everyone who posts accurately, but listen to what people are saying about their lives. That's their story. You can't tell them they're wrong about their life. You know, you can back up and say, okay, well, that technical term wasn't used correctly, fine, whatever. But, you know, having stories out there is huge. This is hugely valuable.
I think too, it helps, you know, when you hear about it, or, you know, because doctors, you're right, will say, well, that's just, I've heard, well, POTS is just the TikTok disease, or, oh, EDS, oh, you don't have that. You know, these stories that I've heard people coming back and what has been said to them. And I get it to a point that, yes, all, like you said, all social media is incorrect, but also these people's stories, and by just sharing what your experience was, what my experience was, they can relate and say, maybe it's a mom. They've been searching for answers. Their daughter doesn't have the energy, or, you know, something. And they're like, you know what, this sounds like it could be. There's power in that like just by sharing your story, at least gets the word out there, the diagnosis, the process, the symptoms, something. And then you can take it to your physician. It's the blessing and the curses of social media, but so much good if you look at it more not like as life or death. And it's just like, okay, let me gather the info. I think Dr. Nance always says, like, gathering the data points, and that's like what it is. And it's so true. Like, gather the points and see how it is.
Exactly. It's almost like we clinicians in general just sort of looked at this huge pool of data and said, nah.
Yeah, right.
Not that we didn't make it, so it's not good. I don't know. It's an unfortunate missed opportunity, honestly. But, you know, I think one of the things that people forget in terms of, you know, how social media works, how it gets you, is that it's designed to show you more of what you've shown interest in already. So if you are looking at a video that, you know, and you like, oh, you scroll back to the beginning, you watch a few times because you missed some words, it's going to show you more of that video.
Of that.
So you're going to get this very inaccurate sense of a wind tunnel of you know, of a repetition of a theme because it's feeding what you've already found interesting.
That's the dangerous part.
Exactly. Well, so it's dangerous, but it's also, you know, from a clinic. Yeah, so it's good information, but for clinicians to assume that everyone watching, you know, is, oh, it's just the TikTok disease. No. So we're forgetting that it's going to feel that way incorrectly. But at the same time, it allows people who have never before been able to connect with each other. So we actually have to look at the data all fresh from all of this, you know? What if we've just never recognized it well before, which anyone in the field can tell you is true, you know, but we can't throw out all this new information. We just have to look at it, you know, ask a statistician for help. Just do it that way. Don't ever start a research project without asking a statistician. That's what I'll recommend. Use them. But you know, but don't assume that everything is trend, and don't assume that everything, you know, isn't real just because it is online. Yeah,
and it's finding that middle ground, because I think even that's how, you know, the podcast grew. I felt like that there was a gap in the care and the data getting out there from a POTS perspective, definitely a POTS and EDS perspective, and looping in MCAS and all the other things that we've talked about, different physicians that we've had on. We talk about all the time, like a multidisciplinary approach to make sure, like, I can't just only work on POTS if we're missing a whole EDS perspective, you know, or if MCAS is at play too, we can't ignore that. You know, you got to kind of get all your pieces to work together so everything's functioning at its best. In your pediatric setting, are you seeing a large crossover with POTS and EDS?
Absolutely.
Right. I mean, I was like, well, I already know the answer to this question.
That was an easy one.
Right.
Yeah.
Right.
So, and I think actually that's where the role of primary care, either pediatrics or internal medicine or family medicine for that matter, can all do a particularly important job in the field. And that can be either in a true primary care setting where you're also doing your well checks and your sick visits and whatever. Honestly, it's hard to do that because of the length of appointment times needed to do a good job.
Right.
That is not our fault. That is a systemic problem.
Correct.
We can address that another day. But, you know, but the training side, to look at the whole person and to look at all of the pieces, that is primary care in a nutshell, right? Whereas
the quarterback. I always say, like, you know, you need that quarterback to just say, even if they don't fully know, to just be like, something's off here.
Right. Exactly. So if remembering that role is so key. I'm always a little bit saddened because, well, I mean, very saddened by the system in general. Again, topic for another day. But generally speaking, specialists stay very siloed. The fellowship training is a very, this is your lane and this is only your lane kind of space. Whereas general medicine is not. It is not like that. We're trained to know our limits of when to get a specialist involved, certainly. But in order to do that, we have to know a lot about a lot of things, or at least a little bit about a lot of things. Right. Whereas a specialist is just going to look at things differently. So as a general pediatrician who is a specialist, because there's no board certification for Ehlers-Danlos, right? Although we are hoping that one of our projects is to create a fellowship. Yeah, my not next year. Give me a minute. But we do plan on incorporating that into University of Virginia's education. And I'm going to say that now so that I get held to it. I really
That's right. I was going to say, put that out there. You should put that out there.
I mean, we all agree that it's necessary, but give me a second. But there's nobody. There's almost never someone running the show. Steering the ship from the center, and that's where you need someone like me, like my colleagues at UVA. Our plan is, all right, I'm going to be your center point, and yes, I'm usually the person doing the diagnosis for EDS, usually hEDS, but I'm also absolutely treating your POTS. I'm treating your mast cell dysfunction. I'm treating your GI dysmotility. I am reading your neck imaging to see if I need to send you to a neurosurgeon, because there are almost no people who do that. So I learned how to do that, and I was very grateful for having the connections to teach me to do that. I don't know that I could have done that all by myself. But the truth is, once you're in the group, we are thrilled to teach each other. It is rare that you will find someone who does any of these subjects who does not want to connect and help you out. And if they don't have time themselves, they will connect you with someone else. That is what we want for each other, which is really wonderful.
Amazing. Yeah. Because it is hard to find, because then you're treating the whole person, not just one subset. And I say this all the time with my story. I didn't have bad physicians. They were all great in their own way.
Right.
But nobody was looking. I was seeing GI as GI, neurology as neurology, eventually cardiology as cardiology, especially. Yeah. So everyone was checking their individual boxes.
Right.
But nobody was looking at, now from a POTS lens, hindsight, it makes so much sense, all of these symptoms. But, when you're in it and no one is looking at that, it's so easily missed.
So the way I like to explain it to either parents who are not getting it yet, or students who have never seen it before, anyone who's in sort of the infancy stages of understanding this interconnection of conditions, I'm going to say that, what I do is not all that impressive as a physician, so much as that I have the right lens to look through. And what that means is, if you assume, again, this is mostly the H type, but it's somewhat applicable elsewhere. If you assume that the glue holding your body together is not doing its job properly, so instead of all the things working correctly with structure and support, they're not, or at least have the potential to not. And then you look at the symptoms someone comes in with and presents with, and you say, all right, assume something in the area or related could be squishy or stretchy or falling down or something like that. And now give me a differential, which is to say, for families who, that term just means give me a list of what it might be.
Of what it could be.
That's a totally different list than if your structures are working properly.
Right. Yep.
But the thing is,
because there's so much that goes with that.
Exactly. So once you just shift once you shift the way you're looking at the problem, everything else around it makes a lot more sense. All right. So okay, squishy stuff. Well, I bruise like a peach. There's that. Stuff being too stretchy and falling down. Okay, well, blood pooling in the bottom half of the body instead of the upper half of the body. Okay, well, there's hemodynamics there. All right, noted. What about your organs falling down? Oh, well, everything's squishy and stretchy. Okay, all right. Yep. There's that system. What about dysmotility, which includes gastroparesis, like slowing of the stomach, or constipation? All right, well, everything that is supposed to stretch and squish in order to make food go from your mouth to, the outside, it's supposed to have structural support to do that. If you're trying to make a contraction happen so it can squish food to go in the direction that it wants to go, and the GI doctors are sitting here being like, oh my gosh, how is she explaining? Like, no, I'm correct.
No, but it is so perfect. Yes.
But then if everything is too squishy to hold the structure, it's not going to work as well. So there might be times when you have like an adrenaline surge and everything's moving too quickly.
Yes.
Or
running to the bathroom.
Everything's moving too slowly because nothing wants to stretch and support the stretching anymore. But then you add to the connection that, if your organs are too stretchy as well, let's take constipation. If everything is moving too slowly and we're stretchy in the area where everything's lining up to get out, okay, well, now we get ourselves something called a megacolon, where everything is stretching, genuinely stretching to accommodate what isn't moving. That's really dangerous. So, or it can be, but you won't necessarily notice the symptoms until it's really significant because your body works differently.
It's my 8-year-old is the perfect example of all of this. Like, I knew obviously my things, but hindsight looking back, there was stomach issues and then it was so full of poop. We had delayed growth and then that kind of fell off, and we're putting all the pieces together now. But you're right. Like, these are not things that people realize. And I feel like a lot of the younger ones that I work with, the parents are like, we tried, or there were it's nobody's fault. It's,
right.
You're just picking up on these things. So the more you can arm yourself with good research and podcasts and articles and things like that to just be more informed, I think is so telling. And it's, injuries, you see in injuries, you see a GI dysfunction, you see the fatigue. And then exactly what you said, when you're looking at it under that lens, you're like, wait, so much more of this makes sense.
Yeah.
But it's, when we all stay in our lanes, it's hard. So these diagnoses, especially these chronic silent illnesses, really require that multidisciplinary approach and quarterback of care to kind of help you like weed through and navigate what, where to go next.
Yeah. Yeah. And it's if nobody's at the helm, it's very difficult. You end up with a lot of burden on the caregiver in a way that really shouldn't be the case. And, there are just so many pieces. I don't like throwing blame at I'm happy to throw blame at insurance companies. We can do that all day.
Right. Literally.
Fine
so
with
limiting.
Yeah. Fine with me. But, I never want to blame a family who didn't realize. I never want to blame a primary care who's not connecting things because they have 10 seconds to see the patient.
Literally.
I am comfortable saying, hey, don't be a jerk. Like if you have a patient and you're not sure about things, and you do one thing for them, be respectful and be kind and be humble, because we don't know everything that we're going to know even a year from now. So if you do one thing for yourself and for your families that you care for, be kind. Just be kind.
It is, because I think if you sit with someone and say, hey, something is here, I just can't put my finger on it, but I do. Even the validation that, hey, something is going on here. I think that is so special and meaningful, because I was saying to somebody today, like, she was headed to an endocrinologist later. I'm like, listen, I've been there. Don't put all eggs in one basket. Yeah. We're all looking for that basket. Like, this is it. This is the appointment. And, a lot of times it's not that easy, especially with these diagnoses. So, even hearing somebody say, hey, I'm not really sure, but I do believe you. There is something. These symptoms are real. I feel like that, like you said, can just be kind and go so much further.
Yeah, it's the one thing that we have control over of, how we treat others, honestly. So, but just, I think for me, what's interesting is that the physicians and clinicians in general that I remember most strongly being so positive, some of them had knowledge of hEDS or POTS or what have you, but actually the ones that stuck out most at the time were just willing to say, I don't know, I'm going to go learn some stuff.
Yes. I'm going to go read.
Yeah. And it almost doesn't matter if you figure it out all perfectly or just help them to get to the next person. But that kindness is so, like, it costs you nothing and it makes a world of difference, So, but I also always like to share that because, it's easy to feel stuck only looking for clinicians who are EDS knowledgeable already.
Yes.
Right?
Yes.
And while that is obviously wonderful, We can also all get stuck in our own ways of how we treat and how we think about whatever. But if you're with someone who's just open-minded, humble, willing to try or look for something new and different, that's going to get you way further, and opens up options that might not otherwise be available.
I say that all the time because, I did it myself. Like, we're all like, who is the best of the best? I have to go, right? But I say, if you assemble a good team where you are, you can assemble a great team where you are. Somebody who's at least open to it, open to learning, aware, going to research. And like you said, then you take out travel and these long wait lists and all the things. So, I think that's so perfect. I was just talking to somebody. I can't remember what specialty, but I think it was maybe MCAS or something. I'm like, I don't think I would look at it as finding that specific physician. Like, go meet the physician, see if they're open to it. But, having these labels, especially with these diagnoses, I think are harder to find, that physician labeled that. So if you can just go meet the regular physician in your area, whether that's gastro, I mean, you're not going to find, well, very rare, but a POTS, EDS, MCAS specialist, GI,
That would be Zach Spirito.
Yes, right. That's it. Yes, that's it. But yes, outside of something like that, you kind of have to
He's going to
pull it
listen to
back.
this and be like, oh,
Yes.
yeah, hey.
He is. He does. I didn't even think of that. He checks every box.
Yeah.
And if you haven't find him online too. Yeah.
He's also as kind in person as he seems online, just to help
which
his
is
wait
so
list out
hard
a
to
little bit.
find.
Yeah.
Yes. It is. And it's like, these providers, that's a perfect example to what we said earlier. Like, your algorithm starts to pull. I mean, he's giving you quality. I work with a few people that work with him, and I can just see how they're coming back and saying, hey, we're trying this, and he's willing to listen to you and work with you. And I think that's so telling.
Also particularly adept at gathering new information about the field and incorporating it quickly, not thoughtfully, just faster than a lot of us are able to, for one reason or another. And it keeps him on the cutting edge of what's available in a way that's really, really key. The truth is, not to distract from what he brings to the table, but one of the things that I think is super important for anybody looking for a team is that because of our access to research and knowledge in this day and age, it can feel like it's going to be more helpful to say, I read about this condition online. Can you evaluate me? Or I want to be evaluated for that condition. And I wouldn't say that is wrong so much as that can make the appointment a little bit more challenging for a physician than you'd think, because we are trained to look at the problem from the other direction. We are trained to collect, assuming you're doing your job, right? Collect your symptoms, understand the history of the individual in front of you, and then rank according to likelihood,
what it could be.
Which is where the problem tends to come in. What seems most likely. Now, you want someone with all those open-minded, skills like we've been talking about. Correct. Right? But if you go in the direction of symptoms first and then condition, that's how a clinician is going to think, generally speaking. Now, me and others like me, we're going in really the wrong direction. Someone comes into my office and says, I think I have POTS. I say, all right, let's check it out. Now, in the back of my head, I'm always making sure, is it something else? Is it one of these other conditions that are very similar? But if someone comes into a regular office setting and says, this is what I think I have, you're immediately a contentious situation of someone comes in saying, this is what I want, and I'm not going to be happy unless I get it, which is fair, but also not helpful. And then the clinician is in a lose-lose situation unless they're a unicorn and can navigate it, perfectly, whether or not the diagnosis is accurate, because we don't want to give an inaccurate diagnosis. That's not good either. That's really bad care. So it's tricky, but when people go in assuming that's going to help, it can actually harm. So I always want to make sure people, like, the best thing you can do is describe your symptoms in detail, but in regular terminology. And it's okay to write them down ahead of time so you remember, what it is, because I got to tell you, like, sitting upright in the doctor's office is not when most of us do our best thinking.
No, bright lights and you're nervous already going in, the adrenaline's going.
Write it down, but don't try to translate it for the clinician, because that actually can lead to errors and misunderstanding and using terms wrong totally by accident and get away from the results you're actually looking for.
And I think some clinicians too almost like put up like halt, stop, like if you're coming in already, I'm like, and rightfully so, because they want to kind of come in with fresh ears and and kind of come up with, like you said. So I think just being as honest as you can. This is what I'm experiencing. This is how, and writing it down.
And then on the other side, the truth is, like, a clinician who is just doing their job really well doesn't need to be a specialist either.
Correct.
They just need to be, like, again, kind. I'm going to say that again.
Listening, caring,
but humble and willing to look, because if you're willing to kind of, lift the rock up and look underneath and be like, oh, okay, this is something new to me, you can still bring all your skills from GI, from cardiology, from respiratory, from all of those areas. You don't need to be an EDS or similar specialist to do a good job, so long as you are listening intently and being humble and being, we call ourselves lifelong learners. We got to walk that walk,
Yeah, be open and listening. And I think that is, but also then gives people the confidence that maybe they don't have access to all of these physicians in certain areas, but you can find someone locally that can be just as great too.
And I think one of the reasons that it can be particularly difficult to put a team of healthcare people together is that it can seem to the healthcare folks to be so complicated that they don't want to be the one to do it. It's like too scary. But truthfully, if you break it down into these parts, not silos, but just, taking one step at a time and being willing to put the pieces together, you don't have to spend 2 hours to get somewhere. You just have to get somewhere. And then you have to be willing to come back and have a conversation again. And you will make progress that way. It won't be as fast as spending a whole day with one person, fine, but you can be a non-specialist and help someone get better and enjoy life again in one way. You just have to try.
Yeah, just time and listening and being open. And I feel like now people are listening and they're going to be like, well, where can I go see her?
Well,
so tell them, obviously if they're local or like your social media, all the things.
Absolutely.
Because I do think not only for ourselves, but we get a lot of moms who are listening for their kids or loved ones or whatever. And I just feel like, if it was me, I'd be like, okay, where do I find her?
Thank you. So I have just joined University of Virginia. Within the last couple of months, we have launched the EDS and Hypermobility Clinic.
Which is so amazing.
Thank you. Mm-hmm. It's really a thrill. So right now we are 4 clinicians, and it is a multidisciplinary clinic with the intent of growing. So right now we're really overwhelmed and thrilled with the outpouring of interest that we've received.
Yes.
As a result, it's going to be a second if you're adding to the wait list right now, but we are working very hard as a team to figure out how to streamline in an equitable and appropriate fashion. So check back if you have emailed or called. So literally just Google EDS UVA. The first thing that pops up will be our webpage.
Right. And 100%. I know people have been talking about it because it's such a valuable asset and just something so needed.
So if you leave a message or email, I promise someone will get back to you. Do not be alarmed if they do not get back to you immediately. There's one person doing the scheduling. She is incredible, but she's still one person.
Yes, and she's very busy, I'm
absolutely. So so be respectful of her hard work, and and we promise we're monitoring. I am always excited when someone messages me online. I can't give medical advice online. I wish I could. There's legal stuff telling me I can't do that.
Right.
But I'm always happy to, if there's a message about, hey, how do I find someone near me? I'll answer those. I won't answer them immediately most of the time, but I will answer. Answer.
It's okay. Life happens. Yes, it'll come.
I am especially slow at answering my emails, but if you email me at sarah@thebendypediatrician.com, all lowercase. I don't know. It has to be all lowercase. I will email back, but it won't be immediately. But it's really an odd kind of thrill to be in this position, because it feels very recent that I was really only exclusively, the teenager with the condition myself. Yeah. So I had this moment actually just about an hour ago. We were in a meeting with the folks at UVA who do advocacy work on both the state and federal level. And I had this second, and I realized I really looked pink in the face, because it just absolutely hit. where I am and what we're doing.
So cool. It is amazing because it's going to bring peace of mind for parents. It's going to bring healthier children. It's going to bring happier. I mean, it's amazing. It's amazing.
Yeah. The difference of what's available 20 years ago versus now. And by the way, I know the people who were involved in the advocacy at that time and before then. They were in the meeting today too. And it's unbelievable to be present in a moment where this is happening, where this is changing, to be at the table, making the change happen. Because, that little piece of my heart is still the teenager who wasn't able to go to school.
So I love that.
And I love saying it. That sounds sort of weird, but
no, not at all.
I missed almost all of my senior year of high school, and as a result, friendships really decayed because senior year of high school is kind of important socially. But we didn't know what was going on, and my mother was deeply terrified because she knew that I belonged in this sphere. She just knew. And she didn't want it to not become an option. And so I say that very freely because I want anyone whose kid or who themselves is going through that, to understand that there are possibilities here. There are treatment.
Yes.
You have to know where to look. You have to put the dots together, but they're there. They're there, and I can't make promises because I don't know every single person. That makes me a little nervous.
But there's hope. I think that's what it's about. Knowing that you get this diagnosis, or maybe you don't even have it yet, but you're in this place where you feel like there's no hope.
Yeah.
And that's actually was going to be my next question was if you are either yourself or a parent of someone who's either just diagnosed, working on a diagnosis, what advice would you give them?
So first,
what would you tell them?
Oh my goodness.
Yeah.
So how much time do we have left?
Yeah.
So the first thing is trust yourself and trust your child. Most of the time, kids really don't want to be different in high school.
No.
That is the period of time in which they want to fit in. So if they are unable or unwilling to be in the school building, there is a reason, and you need to track down what the reason is. Because no one wants to be the invisibly ill or disabled individual.
They don't want to be at home.
Right. They want to be with their friends. They don't want to. And if they want to only to be with their parent at home, there is a reason. So you need to listen. You need to listen to that voice in your head saying something's not right here. And I'm not saying it has to be this, but you have to listen to that voice. And then keep going. And then keep going because there is hope. There is, and not every day has to be perfect. I spent half of yesterday lying on the kitchen floor because I overdid it in 90-degree heat. I just didn't think about, because I can be outside in 90 degrees, but I'd never been gardening outside in 90 degrees. And I didn't include in the math that my head was down.
Yes.
Oops. But the point is I'm okay today because I know what measures to take. Right? Not every day needs to be perfect. Almost nobody has every perfect day, but you need to know what to do when that happens. So building your toolbox can create the life that you're looking for. You just need to know which pieces go in there. And then you can move. Then you can do what you want, even though not every day is going to be perfect. And that's okay. That's okay.
Yeah. I love that. I say that all the time. You want to build your toolbox. Yeah. It's not about perfection. Nobody has perfection. No. And we still have our moments. Well, I had 90-degree heat yesterday at my son's baseball game, and I came home. I'm like, oh boy, I should have taken electrolytes. We all have our moments.
And next time I'll remember them.
Yes, now I'll know tonight when we go. I'll know.
My mom has sent me a stool so I can sit while gardening.
See, we know.
Okay.
But it's about making those changes, but then also having hope and living a life that's meaningful to you, and know that where you're stuck right now, what feels stuck, it can get better. Just got to have the right team, the right tools. Yeah. And I love that. I think your message about hope and on Instagram, I feel like you share the same thing on there. So they can find you on there at the Bendy Pediatrician also.
Yep, at the Bendy Pediatrician. And I just have so much fun with that. One, it's a creative outlet because I'm like that. Right. But, bringing a dose of reality mixed with the science and the research and bringing that out to the world is really very meaningful. And, it's fun. It's fun to give little pieces of that experience out there, and it's amazing to see what I get back. I get international messages every week, and I wish I wish I could care for everyone all over the world.
Yes. You're touching. your message is
Yeah.
translating to those countries, and it's
My heart just
meaningful
bursts
to
at
them.
being able to do that,
Yes.
and it's a little scary because the algorithm on the creator side really cares about you being consistent, and I'm like,
Yes.
no,
It's overwhelming.
I'm
I know,
not
it's
gonna- It's not
overwhelming.
going to happen for me. But the fact that it's still going as well as I mean, I've only been on social media about almost not quite a year now, and so it's
love
clearly
that.
going great.
Yes.
And my mom is very amused by that because, we were told that the conditions we have, so the hypermobile type is not considered rare anymore. It was when we were diagnosed. But she
Right.
gets a real kick out of, all those followers with the rare condition,
Yeah, that right.
Really,
That-
it affects nobody.
Yeah.
Is that right? I don't think so, But it's always
love
worth
it.
mentioning as well that even for truly rare conditions, collectively, rare conditions are not rare. And you are going to see rare conditions wherever you are as a clinician because that's where they're going. They need medical care. So your assessment of how likely it is has to keep that in mind.
Yeah.
Yeah.
I always say if your spidey senses go up,
Yeah.
something's a little off, right?
Absolutely.
You
Absolutely.
got to trust your gut. You got to find the right team. Look at the social media videos, gather your dots, and really just trust your gut and keep going. So I love it. I love that you bring hope, and you can find her on social media. And I just can't thank you enough for joining us today.
Thank you. This was so much fun. Thank you for having me.
Yeah, so remember to like, subscribe, share with your family, friends, all the things, and we'll see you next time. Bye.